Welcome to O'Dowd Medical Center. Today we have a 5-year-old female patient in for her age-related immunizations. She is in distress and nervous about receiving the shots. Bad nurse aide doesn't wash her hands, doesn't change the linens properly, and doesn't do proper sterilization. The pre-interaction phase involves the nurse aide washing her hands and preparing the room for the patient. The bad nurse doesn't review the patient's chart or plan her actions before seeing the patient.
Your next patient is someone who needs an MMR immunization.
Another kid.
The nurse reviews the patient's chart and plans her actions.
Our next patient is in for her MMR immunization. Thank you.
The bad nurse doesn't take the client's age into consideration when introducing herself and is unclear or lies to the patient when explaining the care to be given.
Hi, Ms. Myers. I'm Andrea. I'll be your nurse today. I have your MMR vaccine. It'll be an injection, and it won't hurt at all. So I'll be right back with that.
The orientation phase involves the nurse introducing herself to the client in an age-appropriate way and explaining what she's going to do in clear terms to them.
Hi, I'm Bria. I'll be your nurse today. How are you? Good. Okay. And how are you doing, Jessica?
I'm nervous.
Nervous? I know you're getting a shot today, but it'll be alright. You're a big, strong girl. I know you can handle it. And if you're really good, we can give you a Dora sticker or a Dora Band-Aid. How does that sound?
It sounds good.
Okay, I'll go grab my stuff.
The bad nurse doesn't comfort, is cold toward the patient, and doesn't use kid-friendly language.
All right, I got your injection here. All right, it's not going to hurt at all.
Mom, I don't want a shot.
It's okay. It's okay. So do that. There.
Ow!
All done.
What are you doing?
It'll stop bleeding in a minute. I need to smoke.
The comforting phase involves the nurse giving the injection and comforting the patient afterward.
Alright, Jessica, are you ready for this?
No, I'm scared.
I know, a lot of people are scared to get it, but you know what? They'll do just fine, and you will too. I know you will, because you're a big, strong girl, alright? So, first I'm just going to sterilize the skin really quick. You see your mom's holding her to the bottom. Okay, I'm just going to do it on the count of 3, alright? 1, 2, 3. Now that wasn't so bad, was it? You did good. Look at that. See? Are we the Band-Aid on? Just like for the first. And since since you were such a brave girl, I'm giving you a nice Dora Band-Aid. There you are. Look at that. Good job, Jessica.
Look, Mom, it's Dora.
Wow, that's so cool.
The bad nurse fails to follow up with the patient and plan any future care.
Peace out.
The termination phase involves the nurse reassessing the patient and talking to the parent about the child's future immunizations.
Hi, Jessica. How's your arm doing?
It's better.
It's just going to be a little sore for today. That should go away and it should be fine. Right?
Okay.
Just keep an eye on Jessica's arm. If you have any complications, you can always call back. She needs to come back for 2 months for her second MMR shot, and you can schedule that with the receptionist in the office. Okay? Thank you. Have a good day.
Bye.
The nurse demonstrated nonverbal communication when she used caring touch to comfort the patient. She also used eye contact and got on the patient's level to be less intimidating. The nurse demonstrated verbal communication techniques when she spoke to the patient in kid-friendly language, not using medical jargon, and she used a soft, friendly tone when checking up on the client. The barriers to the nurse-client relationship were shown by the bad nurse when she didn't provide privacy, used medical jargon, had a lack of caring and empathy, and didn't build a trusting relationship with the client. The bridges to the nurse-client relationship were made by the good nurse when she established a trusting relationship, showed caring and empathy to comfort the child, and provided privacy for the patient. The nurse demonstrated Swanson's theoretical view on caring by understanding that the patient's scared about receiving the shots, being with and sharing feelings with the patient, comforting them, giving the shots skillfully, enabling the client by informing them truthfully about the procedures, and believing in them.
Marry me, Juliet, you never have to be alone. I love you, and that's all I really know. I talk to your dad, go pick out a white dress. It's a love story, baby, just say yeah.
And a little bit of chicken fried, cold beer on a Friday night, a pair of jeans that fit just right, and a radio. See sunrise, see the love in my woman's eyes, feel the touch of a precious child. No mother's love